Thank you, Andrew, and good morning, everybody. I've got my timer started because we're running close to time. Now, this is a very funny room. I'm going to show some slides. You may not be able to see them if you're at the back of the room, so if you turn around, you can watch on that screen, and if you're looking at me with the back of your head, that's fine, as long as you can see what you want to see. This is a really important day, having a look at where GPRA is and where GPRA is going. And what I've got up here for you, I don't know why that one's not on. This is a map of the world from young family doctors from all over the world. And as part of WONCA, we got young family doctors to tell us what is the word for general practice or general practitioner in their languages. And here you can see the languages of the world represented. Family medicine is growing everywhere. I'm not here with you all day because I'm heading off to Indonesia this afternoon, where we've got a big meeting looking at the establishment of GP training in Indonesia. They're 45 years behind where we were, but gee, they're enthusiastic in getting things underway. And it's really important, the work that they're doing. Yeah. All right, now this is from your website. It says what GPRA and the associated organisations, including GPSN, are all about. A peak voice for the next generation, a not-for-profit organisation representing over 25,000 people in Australia, and a primary objective to improve the healthcare of everyone in Australia through excellence in education and training and through ensuring that general practice is the medical specialty of choice. I think part of the work today is determining, is that still what you want to be as your goals and objectives, or is it something else? I also put the logos of the four big programs which you're running there, because I think that these are incredibly important. They've been developed over many years by the leadership of GPRA, and they represent a continuum, don't they, from medical student to recent graduate to registrar, and also with the incredibly important focus on our Indigenous members. So why are we here today? In the letter that I received, we're going to look at the role and functions of GPRA, the value propositions for members. Why would you be a member of this organisation? The role of conferences and other ways of information sharing, and also the socio-political factors impacting on general practice. And no surprise, I want to talk a little bit about some of the socio-political factors. So here's our Health Minister. Sorry, that was last week. Here's our Health Minister. And our Health Minister, in one of his very first presentations to the media, talked about the importance of general practice and general practitioners. And here's what he had to say. I want to re-establish that value, their role, their importance, their trust in the community. I'm biased towards nurses. As the son of a nurse and husband of a nurse, I'm biased to the nurses and our volunteers and our allied health workers. But I do again want to repeat that for GPs, I want to be their health minister. Our health minister. So I think we need to build on this, but we've got to be quick because this health minister is a bit of an action man. He makes a decision on Monday, he expects the bureaucrats to have implemented it by Friday. So he's got people in Canberra running around in circles at the moment. We also know that the public values the work that we do, and we saw this during the most recent federal election with the Medicare campaign, with the campaigns. It's good to see Malcolm Turnbull there talking about Medicare and why a doctor's angry. He's out there for us. And a big focus on the importance of Medicare and the provision of healthcare to everybody in Australia, much of which occurs through general practice. This is the major current federal government initiative to support general practice and primary care. It's called the Healthcare Homes Initiative. It's exciting, but it's only being rolled out through 200 practices. It's only enrolling 60,000 Australians in a population of many, many more. And I got into trouble when I called it a pilot recently. It's not a pilot, it's a phased implementation. I said, does that mean it will roll out nationally? Well, we'll see how the phases go as to whether that happens. It sounds like a pilot, but there you go. Now, a little bit about WONCA. WONCA is the World Organisation of Family Doctors. If you're a member of ACRM or the RSCGP, you're also a member of WONCA. Whether you knew it or not. And WONCA represents family doctors through their colleges and academies in over 160 countries around the world. There are over 300,000 of our colleagues who are members of WONCA and the WONCA family. This is the very first president of Wonka, who was an Australian, Monty Kent Hughes. And in his very first address, he said, "The future of our professional discipline of general practice, family medicine, will depend on our ability to work together in the service of humanity." And I think that's really important for you to think about here today as well. It's working together, it's the service of humanity. And I think that also ties back to your own set of objectives. Why are you doing what you're doing? A couple of years ago, Ban Ki-moon, who was then the Secretary General of the United Nations, talked about how the world is at a historic crossroads. And he talked about how we can decide to end the age-old ills of extreme poverty and hunger, or we can continue to degrade our planet and allow intolerable inequities to sow bitterness and despair, and talked about how can the world work together to achieve sustainable development. That was 2 years ago. Things, of course, have changed with the recent election in the US. I'm not sure if these are necessarily the principles that President Trump adheres to, but the UN got together and they put together the Sustainable Development Goals. And these are the goals for the next 15 years that the nations of the world, including Australia, have signed up to try and make the world a better place for all people. First one is about no poverty, second about no one living in hunger. The number 3 is about good health and well-being for all people. And this is what's being called universal health coverage. How do we ensure that every single person in every single community in every single country gets access to healthcare? Healthcare, of course, being regarded as a fundamental human right. The WHO, one of the agencies of the United Nations, is currently led by Dr. Margaret Chan. Dr. Margaret Chan, in a recent presentation that I went to, stood up and said, "I have a secret to tell you all. I love family medicine." And all the GPs, family doctors in the audience stood up and clapped, and all the other specialists looked really unhappy. But she talked about why she loves family medicine. Dr. Chan sees strengthening primary health care and including the role of family medicine as being the way to achieve universal health coverage. So we are part of a global movement, and a really important global movement that's gaining traction in many, many parts of the world, to look at how do we strengthen primary care, the role of family doctors, the role of general practice in ensuring healthcare for all people. And there are some very big players who are getting on board as well. The World Bank, the Bill and Melinda Gates Foundation, the WHO have come together to develop a new initiative called the Primary Healthcare Performance Initiative to support low and middle income countries to build better healthcare systems. And Wonka's been part of this initiative as well. I went to the launch at the United Nations, and this man spoke. This is Bill Gates. Spoke at the launch, and he said something which I found really remarkable. Bill Gates has spent the last 10 years donating much of his fortune to programs to help healthcare and education around the world, but especially vertical programs especially for immunisation of children and other vertical programs. And he spoke about how we hear arguments about vertical and horizontal healthcare. The horizontal piece is the most important piece. I nearly fell off my chair when someone like Bill Gates said that. And now his investment is more into the horizontal basis of healthcare, the primary healthcare system, which we're all part of, rather than these vertical programs where some people get support and some people miss out, and where healthcare provision can be somewhat haphazard. And of course, global healthcare exists in Australia as well. Recently, last month, had the opportunity to spend a month in Central Australia with the RFDS and the Remote Primary Care Service, working as a doctor, visiting our remote communities, visiting some of our most needy communities, and seeing what the healthcare challenges are for Aboriginal communities in the centre of Australia. So on to the meat of today. Do we still need a GPRA? Or can we rely on our health minister, our colleges, other professional organisations, our regional training organisations and others to represent the interests of GP registrars? Well, if you decide to go down this path, be very, very careful. All right, I think your best bet is self-determination. But if you're going to still have a GPRA, you need to think about what you offer to members. Members are going to be asked what they want to be the focus of their organisation and what changes are needed. But the big question I have is, what are people willing to contribute? Are people willing to put dollars towards being a member of this organisation? How much time and energy are people willing to contribute to this organisation? I think we have a fantastic opportunity, though, with GPRA, because there are so many young doctors in Australia who've been part of GPRA through their membership of GPSN. And GPSN, 14,000 plus members last year, fantastic editorial by Dave Townsend and others in most recent MJA talking about the success of GPSN. So I think you can build on that success. What is the value of a GPRA? Well, I think GPRA provides you, the future and newest members of our discipline, with some self-determination, with the ability to support each other, with the ability to advocate on the things that you think are important, not the things that other people think are important for you. And most importantly, it provides this very proactive focus on the future of general practice, of family medicine in Australia, because you're part of the future. You need to be there determining what's going to happen in the next 50 years to healthcare in our country. Can we fund GPRA through the annual conference and other events and sponsorships? Is that going to be enough to allow you to do the work that you need to do? Think about that very carefully. And I think that social media provides you with a great opportunity as well. And if you're not a member of the Raja Kumar movement, I encourage you to join. That's the young family doctor movement for family doctors in the Asia Pacific region, which we're part of. But these are the 7 young doctor movements which Wonka hosts throughout in the regions around the world. And look at some of the initiatives which they're doing, especially the Vasco da Gama movement, the oldest movement. It's been running in Europe for 12 years. Look at some of the actions which they're doing, some of the social media platforms which they're using, how they're influencing what happens. Vasco da Gama movement is in Europe, how they're influencing what's happening in healthcare in Europe and influencing the EU and their individual countries. And I think we've got some great examples of social media in Australia as well. GPDU, who belongs to GPDU? Some of you? It should be all of you. Get on board and find out what people are thinking, and maybe we can use this ourselves. My final slide is a message from a lady called Iona Heath, who was president of the Royal College of GPs in the UK, and she recently said to me, I believe that general practice is a force for good throughout the world, and I agree with her. And I think that by working together, by being really fixed on what is our vision and what we want to achieve, we can be part of this force for good, both here in Australia and also influence what's happening in other parts of the world as well. Thank you.